Telcare is a company that we started really just 3 years ago around the notion that if we could connect patients to their caregivers, to their physicians, to their family members, to the other people they rely on around the care of a chronic illness like diabetes, we could make magic happen. And one of the reasons we chose diabetes as a starting place, aside from the fact that 28 million Americans have it, is that it's a disease that people really monitor with these little blood glucose meters that were sort of state of the art when Apollo 13 was launched. Nobody's done too much with them since. They've made them smaller, they've made them pink, but other than that, nobody said, how do we take this ubiquitous device and use it to connect doctors and patients? So that was our notion in starting Telcare, that we were going to do that. And at the time we had that notion, there wasn't a lot of thought in the world even about the whole notion of wireless medical care. Well, lo and behold, 6 months later, Qualcomm realized that all those chips that they had invented that went into cell phones could actually go into these sorts of devices as well. And the Wireless Life Sciences organization started up, and people started talking about mHealth. And the next thing you know, the National Institutes of Health started hosting a 5,000-person symposium every year just on wireless healthcare. So we wound up in the middle of this extraordinary wave of enthusiasm for connecting physicians and patients in order to impact the diseases that currently consume 7 out of 10 healthcare dollars today. It's very simple. Anybody with diabetes has a glucose meter. You probably have friends who walk around with glucose meters on a regular basis. And what they do is stick their finger, look at the number on the meter. They're supposed to write it down in a logbook, but most of those logbooks get filled out in doctors' waiting rooms or doctors' parking lots. And then they're supposed to talk to their doctor every 6 months. And with Telcare's product, all you have to do is put a drop of blood on the strip. When you pull the strip out, it transmits the number right to the cloud. Your physician can see it. If you're a child with diabetes, your parent can see it. If you're an elderly person with diabetes who needs help from your adult children to keep things in good control, they can see it. So we've created a whole ecosystem of care around the patient, but we haven't asked the patient to do anything different. It's as easy to use as a Kindle. In fact, that was our model. We said if the patient has to do one thing different, we failed in our job. All you have to do to prevent the complications of diabetes, stroke, heart attack, blood pressure, losing a leg, all you have to do to prevent those outcomes is keep your blood sugar under control. Except we know that for at least half the people who have diabetes, that's not the case. And we also know that even improving control 10% is enough to reduce complications of diabetes by 37%. So what we found is that if you create that feedback loop using wireless technology that's been inside cell phones for 10 years, but never before inside medical devices, you can totally transform the care of that chronic illness. We're a small startup company. We've been working in a corner for the last 3 years trying to bring something innovative, disruptive to the marketplace, and being recognized by an organization like Edison is just an extraordinary honor for us. It's humbling for us.